Today on the show, we have Dr. Kaitlyn Woodley, a holistic veterinarian, also known as the Natural Pet Doctor. Welcome, Katie.
Hi, thanks for having me.
So, Dr. Katie, before we get into your story and all about how to pick the best food for your dog, we have a quick word from our sponsor, which is Sunny's Goldens, the first line of supplements specially designed for the unique needs of golden retrievers, loaded with 10 awesome ingredients specially designed to help Goldens live long, healthy lives and deal with some of the typical problems that Goldens face, like skin issues, allergies, achy joints, and of course, a big boost of immunity for some of those bigger problems that Goldens face in their life. You can learn all about Sunny's at sunnysgoldens.com. That's SUNNYS, goldens.com. And podcast listeners can get 10% off their first order by using the code PAWcast. So, getting right into Dr. Kaitlyn Woodley. Again, she's a holistic veterinarian. She's a Colorado native, but started her veterinary career in New Zealand before moving back to Fort Collins, where she lives now. Her interest in holistic medicine began when her husband was diagnosed with an autoimmune disease, and the limitations of conventional medicine left them feeling unsatisfied. After diving deep into the world of alternative medicine and seeing results, she knew that her furry patients deserved the same care. So she went on to create the Natural Pet Doctor to give parents and vets more resources for natural medicine. She offers nutrition and herbal medicine consultations to ensure that all pets can live a long and healthy life. You can find Dr. Katie at thenaturalpetdoctor.com or follow her on Facebook and Instagram at thenaturalpetdoctor, where you, and on all those locations, you can subscribe to be a part of her Natural Pet Tribe, where she has all sorts of resources and webinars and more, all around helping your dog live a healthy and happy life. So, Dr. Katie, welcome again.
Thank you. It's great to be here.
So why don't you take a second to fill in anything I may have missed there? We'll get right into your story and how we can help pet parents make the best food choice for their dogs.
All right, sounds great. So, like you said, I ended up in New Zealand to go to vet school, which was an amazing experience. Out in the countryside, had a little lifestyle block. I got to see what it was like to grow all our own vegetables and lots of fruits. And we had sheep and lambs and raised chickens. And so that kind of gave me an intro to what like a holistic life looks like. After being there for 7 years, we moved back to Colorado. And that's unfortunately 6 months in is when my husband developed autoimmune disease. He is from New Zealand. So you start to wonder, okay, what's different in our food system environment that might have triggered something to develop there? And I started to wonder, why am I not looking at the holistic side for animals and my pet patients? I was tired of having pets come to me and they would have chronic illnesses and cancer and we're using conventional drugs, but we were never fixing the ultimate problem, the root cause. We were just treating symptoms to try to make them feel better or slow down the disease, but it wasn't actually fixing the disease. And so I reached a point where I was just tired of saying there's nothing else we can do. And I became acupuncture certified 6 years ago. And that opened up a whole new world for me, and being able to help pets with pain and appetite and help with their immune systems. And then 3 years ago, I started doing Chinese herbal medicine, which has changed my practice completely. So coupling all of those together for a more holistic approach, looking at what the root causes and why these problems are happening, has changed my patients' outcomes. Pets are living longer. We're able to help control diseases like cancer and other chronic illnesses. But the main thing is also preventing those diseases from occurring in the first place through wellness. And so that's where nutrition comes into play. Nutrition is definitely the foundation for our health, as it is for us. We are what we eat, just like our pets. If we're feeding them poor quality proteins, lots of grains, gluten, things that are highly allergenic, they're not going to do very well. And so one of the big parts of my story recently, unfortunately, is that my own pets have had cancer and dealt with that. But my German Shepherd, who's still with us, he's had a brain tumor for about 7 months since we diagnosed it. And he was supposed to have passed away 6 months ago. He's not on conventional meds. He's on Chinese herbal medicine. He's on supplements. He's on a natural diet, so a home-cooked diet. And I would say he's thriving. Yes, we do have some setbacks every now and then where he'll have a bout of seizures, but he bounces back. He's like a little miracle puppy, which is incredible. And I know it's because of what I do for him. So his story, he was on kibble. He was on kibble for about 7 years of his life. And he got to a point where he didn't want to eat it anymore. And it started me thinking, like, why am I feeding this if this dog doesn't want to eat it? What's wrong with it? Because animals have to eat to survive, right? They're not like us. They're not thinking through the processes and thinking, well, some actually are pretty smart, but they might hold out for that extra tasty treat or things like that, or manipulate us, right, with those sweet little eyes. But he was spitting out his food. He wasn't happy. And so I started doing a home cooked diet that was balanced, and he dances for his food now every single day, which is huge. That means he likes it. He feels good on it. It's slowing down the cancer that's going on in his body, and he's doing fantastic. So that definitely is a true testament to how well this side of medicine, the Eastern side of medicine, can work for pets.
Wow, quite the story, and super happy for you with the turnaround of Finn there. So seeing his pictures on your Instagram, and it looks, I mean, I thought he was a lot younger. He looks so happy and healthy, and so it's really cool to hear. Most holistic vets have stories, so many stories of their patients, right? But it's always really touching and personal to see it when it's your own. So thank you for sharing. I know we'll get into a bit more about that. So I think what I'd like to do is, we get so many questions, and also on the Sunny side, with folks looking for the best food for their golden retriever, for example. They're asking around, what is the best food for my dog? And so to me, it makes sense to start that question or at least the answer to the conversation around it with just the most bare bones, basic kibble that someone who knows absolutely nothing about nutrition, either for themselves or their dog, is likely to encounter on the store shelf of any mass market grocery chain, whether it's a Safeway on the West Coast or a Piggly Wiggly in the Southeast, or I don't know where all what chains there are elsewhere, but you get the idea. So just starting that very basic level, someone picking up a bag of kibble that has a nice picture, and it happens to be the breed that they have on the package. They pick that up. What should they do next?
Okay, so I'm going to first say that myself as a veterinarian walking into a store is overwhelming. So I can only imagine how overwhelming it can be for a pet parent to walk into a store. You're surrounded by these beautiful bags, wonderful marketing schemes. There's Life Source bits and other wonderful things that are advertised on those bags. So the biggest things that you want to look for when you walk in and you go, this bag's pretty, right? This looks good. It looks like, this would be good for my pet, is turn that bag around. And what we're looking at, for one, most pet foods on the market are going to be AAFCO approved. So AAFCO is the American Association of Food Control Officers. And what that means is that food is nutritionally balanced for all life stages. And so you could feed that to a puppy, you could feed it to an adult, you can feed it to a senior pet. And so you're going to see AAFCO approved on that bag. If it's not on there, throw it away. Like, just put it back. Don't even go there, because nothing has been done to study that. So that's the first thing you want to look for. The second thing is your guaranteed analysis. So you're going to be looking at the ingredient list, the guaranteed analysis, because that's going to be it should be on every single bag of food. Look at your ingredients. Now, the pet food companies have picked up what we want to see. We want to see chicken or meat as that first ingredient. Now, here's where the difference lies between a chicken, okay, which is like a raw meat, versus a meat meal. So if it says chicken, it's going to be the raw meat. So what happens when they cook that food into a kibble is that it's going to be broken down, dried up, and you're going to lose potentially 70% of that meat protein. So it's not necessarily going to be a higher concentration of protein in that food. So then the next thing is what are those next 4 ingredients? Are they meats, or are they corn, or are they a grain? Now, if you see corn and other grains that are listed in those next ingredients, we have a problem, because now that protein, even though it was the first label on that ingredient list, it's not the first, it's not the majority of that food. And so that's going to be a really high carbohydrate based food. Now, meat meal is already dehydrated down. So what you see, it's going to be a more concentrated form of protein source for that pet in that food. So if you're seeing like meat meal and then you see another meat and another meat, you can feel a little bit more safe and reassured that food is going to be a higher protein content. So I think that's the most simplest broken down form that you can look at your foods. Now, if corn's listed first, put it back. You don't want that. So corn, even if they're putting organic corn and organic millet and all of that, the carbohydrates that are in that, they can be highly allergenic. Our pets aren't made to have carbohydrates, especially cats. So a lot of times you'll see pea protein being used too, especially in your grain-free brands. That doesn't mean that it's better for your pet. It means it's a cheaper form of protein that's being used to go into that marketing fad of the grain-free. Yes, grain-free definitely has a place, but don't get pulled into that marketing scheme. So those are the things to look for. Is meat or meat meal in the first 5 ingredients? If you also, your vegetable sources, is it whole vegetables? Does it say like sweet potato, or is it saying that it's, partially broken down? So you can look at those ingredients and see, are these real foods? Are they quality foods? Is it AAFCO approved? And then also you can look and see, is this a human grade meat? So this is where it gets really scary. And I know I'm actually going down a rabbit hole right now. So,
Right.
So you have your human grade and animal grade. Those are 2 completely different things. If they're human grade, that means that we could eat it. It's not labeled for human use, but we could potentially eat that source of protein that they're using to make that food. If it's an animal grade, good luck, right? So it's anything.
It just won't say anything on it.
Yeah. So usually it says like meat.
Right.
If you see meat, what meat is it? Right? So it could be chicken, it could be beef, it could be roadkill, it could be rendered horses, it could be dogs and cats from the kill shelter, like that have euthanasia in them. That's what we use to euthanize pets. And that's why there's been recalls with food companies in the past few years where that's been found. And people wonder, how is that in the food supply? It's an animal grade proteins. Where do all those pets go? I hate saying that. They have to go somewhere. Unfortunately, they're going into our pet food supply.
Wow.
Which is really scary. So, and then also if you're looking at the ingredient list and you're seeing preservatives, right? BHA, BHT, ethoxyquin, those are bad. So even propylene glycol, it's a second cousin to antifreeze. You should not be feeding that to your pet. You can only imagine what it's doing to their bodies, creating inflammation in the GI tract, leading to diarrhea, leading to inflammation throughout the body, which then creates a whole cascade that leads to chronic illness, cancer, a whole host of other health conditions that now we have bigger problems that stem from the food that we were feeding.
Yeah, and in terms of coming back to the meats and meat meal, there's also, for example, chicken byproduct, which is even worse, right? Because it has many of those BHA or BHT things in it that don't necessarily have to be reported on the label, because within the composition of that one single ingredient, it's at a level that does not have to be reported. And so that's the whole other issue. So it's like you said, put the bag away if the first ingredient is whole grain corn, but probably also if it contains anything that says byproduct. And
yes, correct. So byproduct is going to be anything where the meat, so let's take a chicken. So you strip off the chicken breast. So you're taking away the meat that's going to be beneficial for the pet. So it's anything else. So beaks, feathers, hooves, any byproducts that they can't use for other products for like the human side gets thrown in, and that's a byproduct. There are some good things that can come from byproducts like gizzards, hearts, things like that. So like organ meats. Now, is that organ meat, was it pasture raised organic? Most likely not. So you're going to have all sorts of pesticides and hormones and growth hormones in there. But that's not going to make up the majority of it. You're getting all this other stuff that's not good for that pet. And they're saying that that's the protein that's in the food. Not okay. Not a biologically species appropriate diet for our dogs and cats to feed.
Yeah. Now you started touching on, the carbohydrate content, the protein content of the food. And in the beginning, you started talking about the guaranteed analysis. Now, is there any information that someone can glean from that in order to give a data point on how, appropriate this may or may not be for my dog?
So it can be a little bit harder to analyze that coming from just a consumer perspective, because there's a lot of things that go into that guaranteed analysis. So when they put percent protein, it may not necessarily be the true percentage. So that's something to remember when you're looking at that. But we're going to always want a higher percentage protein versus carbohydrates, especially for cats. Cats, we don't need to be feeding carbohydrates for a healthy pet. Now, if pets are starting to develop, kidney disease or liver disease, there's a place for using carbohydrates to reduce the protein content, so it's easier for their bodies to digest. But looking at that, higher protein source, so higher percentage, you want a lower percentage carbohydrate, you're going to find that those percentages are going to vary a little bit. You also need to look at your fat content. We have a lot of overweight animals, which leads to chronic inflammation, chronic disease, cancer. And if we're feeding them a lot of these foods, and we'll talk a little bit more in a second about it, like raw foods, if they're a high fat raw food and we're feeding that to our overweight pets, we're actually not going to be helping them. Or if they have conditions like pancreatitis, where they're really sensitive to the fat contents in food, we shouldn't be feeding a higher fat food. So you can look at that percentage and see. And then if we have pets that burn off a lot of calories, tend to be more lean, we can actually feed a higher percentage of fat also to them. So we can look at those different percentages. The biggest thing is carbohydrates should not be that high. They should not be the biggest percentage of the food.
Well, the challenge with the carbohydrate is it's not listed on the label, right? The guaranteed analysis, they're not required to list the carbohydrate percentage. So basically, you have to take the first 4 or 5 things listed there and subtract that from 100 to get kind of close, right?
Yes, that's correct. Yep.
So someone picking up the label, like this is one of the first thing I do. I'm not saying this is the right step to do it in, is I look at that guaranteed analysis. I look at the protein percentage, and again, like you said, it's the maximum reported, so it doesn't mean that is the actual amount. But there's protein, there's fat, there's crude fiber, there's moisture, and then I've heard to potentially add like another 5% for ash. Basically, add those numbers up and then subtract that from 100 to get the rough carbohydrate content. But regardless of the kibble, it's always in the 30 to 55, sometimes 60% range of what of the carbohydrate content, which is just like eating a it'd be like the human equivalent of eating a big old Subway sandwich with like 2 slices of meat in it, and grandma's saying, "Where's the beef?" kind of thing.
Yeah, and they're eating that for every meal. So that's the other thing. If you have a kid, would your pediatrician say it's okay to eat oatmeal for every single meal? Oatmeal by itself can be a decent meal, right? There's a lot of qualities that can come from oatmeal, lowering blood sugar, cholesterol, things like that. But you're not going to eat that every single day. So you think about, you're feeding this higher carbohydrate food that's dried. There's no moisture in it. So, or it's low moisture, very low moisture compared to canned foods, raw foods. And so we're actually putting extra strain on our pets' bodies throughout their entire life by feeding a kibble diet their entire life, because there's not enough moisture for their kidneys, their liver, to have the organs working effectively and efficiently throughout their life. Yeah.
The other thing that seems important to cover is the trick of ingredient splitting on the label, where like you said, most brands know that consumers know that you want meat to show up as the first ingredient, right? But let's say that further down the label you have pea flour, you have pea protein, you have pea starch, and then you have peas. Those are all listed as separate ingredients on the label. But if you were to add them together, of all the ingredients from peas, that would then become the first ingredient on the label. So it's a little trick that is very misleading. And that's one of the things that I think people should look out for, because you're right off the bat, that you're dealing with a misleading brand that is being intentionally misleading.
Definitely. And that's where too, if you see that it just says like chicken, and then you see all those other ingredients further down, there's no way that chicken is the predominant portion of that food.
Yeah.
We were all just looking for that. We want to see what's the first one, what's the second one. Maybe other people will look at third, fourth, and fifth, but we need to start looking at the entire label and the ingredient list.
And, you may or may not want to take sides, but I'm going to put you on the spot a bit since we're on the kibble topic. Are there any brands of kibble that you feel are, Dr. Katie approved, or at least, a better version of kibble for pet parents who, either can't afford to feed their dog raw or home cooked or whatever it might happen to be, but they still want to make a good choice?
So it's hard. It's an ever-evolving system. So companies are being bought out by the bigger companies, and then they're changing the way things are being made. The biggest thing that I look at is I like the companies that are doing human grade, or trying to do human grade. So those are potentially going to be a little bit different. There are some like boutique companies that are coming up that I like. Some of the brands that I have recommended in the past have been bought out too. So it's a little bit disheartening to see that happen, because it's just a big kind of game with the pet food industry. I think the biggest thing is, do exactly what we were just talking about. Turn that bag around. I'm not going to bash any of the pet food companies. There are some that are really, really good at marketing. And I see so many cases of diarrhea from those foods that are being fed. So the biggest thing is how's your pet look on that food? Because I can make a recommendation, but if your pet has diarrhea, is super gassy, is vomiting, doesn't want to eat it, we have to look at, okay, this pet may actually not be suited for that pet food. So that's the biggest thing to keep in mind too. Not every pet is I can make a recommendation, but it's not going to suit every single pet, because their immune systems, their digestive tracts are different. And so if you are transitioning food too, the biggest thing is you want to slowly do it. So slowly transition over, especially if you're going from something, kibbles and bits, like we all know that's bad food. Like, don't feed that. Not a good food. So
it's like please. The Flintstones vitamins of dog food, basically.
Yeah,
right?
It's awful. So like, if you have your pet on that's okay. Like, what we can do
exists?
What was that?
It still exists, kibbles and bits?
I believe so. There's some pretty bad stuff out there. So Old Roy is another one. Please don't feed that. So the biggest thing when you're feeding a cheaper food, and more expensive doesn't mean better. That's the other thing. Because people always say, I got the most expensive bag. I'm like, doesn't mean anything. You're probably paying for the marketing. Yeah. So the biggest thing is really, really cheap foods usually are pretty cheap because of the ingredients that are in there and what they do. And so the quality isn't very good. So if you are feeding that to your pet, it's okay. Doesn't mean that you've caused lifelong damage to your pet, because you can transition them. And so you want to slowly transition them over 2 to 3 weeks, where you're slowly adding in more and more of the new food, because you may have to trick your pet into liking the new food, because you've been feeding them like the equivalent of cheeseburgers and French fries.
Right.
Like, they like it because it has additives and flavorings and all sorts of great things that are not good for their health added to it that make it taste really good. So that's the biggest thing. So if you find a food that higher protein content has meat as its number one ingredient, well, and I say that the first, 4 or 5 ingredients, we know it's the bulk of it. Yeah. And AAFCO approved, transition over, see how your pet does. If they don't want to eat it, if they're gassy, if they're not doing well, their coat looks awful, they're not shiny, they're flaky, there's something else going on with that food. It might not be the best suited for them. So
No, I was at the Dogs Naturally show in Chicago earlier this year, and there are a couple of freeze-dried raw brands there, of course, and there's another brand that seemed to be a potentially promising, better version of kibble. It's been around for a long time, and it qualified as grain-free, but they didn't use any peas or any other cheap ingredients like that. Rather, they used millet, one that you mentioned earlier. And the carbohydrate content was on the low end of the spectrum. The argument around using millet and it being a better option as a carbohydrate source was that it had a lower, its composition was a lower percentage of sugar than, say, corn or wheat or oats, for example, which are 70, 80%, 90%. And this was, millet essentially was like 2 or 5% sugar. And so the idea was that would have a less strong effect on blood sugar response and therefore inflammation, etc. Any thoughts on that?
So it's interesting. I was just listening to a podcast with Rodney Habib. He was interviewing a nutritionist, and he was actually talking about millet and how it's really hard to break down millet. So when we're looking at that, I would say we want to look at what else is in that food that can potentially slow down the absorption of, or slow down the release of blood sugars. Because if millet's not really being able to be broken down by the body, we have a bigger problem, right? We're putting something into the body that's not doing anything potentially.
Yeah, it's basically a seed as opposed to like a grain necessarily.
Exactly. And so that's where, okay, can we look at what about adding other starches like sweet potatoes or things like that might actually help, and then are also feeding the microbiome in the gut. So that's, the good bacteria that's in there. So we're supporting a healthy gut environment versus putting something in that's not being absorbed, and maybe it's even creating inflammation in the GI lining. So there's a couple. Ziwi Peak is one that
I was going to mention. Wanted to get into Ziwi also, and before, you mentioned sweet potato. So we went through this with the formulation of Sunnies, for example. I mean, all these manufacturers, they try to push you into, well, just use, you don't want to have a grain formula, so there's no wheat, etc. That's easy. We just use chickpeas and brewer's yeast and whatever else. And we said, no, absolutely not. And so our formula took, 6 more months to formulate. We had to source a lot of these things ourselves. We use non-GMO sweet potato and tapioca or yucca cassava, whatever you want to call it, which, seemed like a much more, natural or digestively amenable source, because you have to have some sort of base in the tree, right?
Yeah.
And so interesting to hear that around millet, because I was really questioning that. And I know from my own experience cooking millet that it takes a long time to cook. It's not something that it takes longer than quinoa, for example. And so, maybe a sprouted millet or a pre-cooked millet might be a better choice, but that's going to raise the price. So yeah, another brand that was at the show, which I had a really great conversation with and really liked what they were doing, was Ziwi. And maybe whatever you were going to mention about them, go ahead. I cut you off.
No, I love the ingredients that they use. I might be a little bit biased because I went to vet school in New Zealand and lived there for 7 years. But the thing is I also saw their agricultural system. All the animals are on grass. They're eating what they should be eating. They're not allowed to put growth hormones in the food or into the animals that then end up in the pet's food or our food. They use less it's more natural. And when I say natural, I don't use the natural term that, everyone wants to use to make you feel good. It truly is. It's truly, those animals are living their best life. Yeah. So they're going to be healthier. There's less stress. There's less inflammation in their bodies. And so they're utilizing that. And then they're also using organ meats. So, and those are going to be a really great source of bioavailable nutrients and minerals that are going to be really good for those pets. And what's nice is they have that air dried. Yep. So if you don't want to use the canned versions because maybe you have a really big pet or, it's going to be it's not cost effective for you, you could even potentially mix that in to the kibble. So you're reducing the amount of dried food and replacing it with something that's more bioavailable for your pet. And it's going to be better than feeding 100% dry food, dry kibble. So
Yeah.
I like that brand. They're doing it right. And the ingredients are really good. The bags are a little small, so, which is a downer, but maybe they'll come out with a bigger, actually they probably won't, because you don't necessarily want bigger bags, but keep things fresh so it doesn't go off. But yeah, I think that's I recommend that all the time to my pet patients.
Yeah, I've a few of the golden retriever parents that have come my way that are on kibble, et cetera. I've recommended that and just said, hey, put this in, and just to kind of crowd out some of the the typical kibble. And like you said, it has the organ meats in there and has tripe, which I gave a pack to my sister for her little golden retriever puppy Gidget, and Gidget just goes bonkers for it. And she's on basic kibble right now. We'll see if we can make that evolution, but that's another episode. So in it, air dried. So there's Ziwi wasn't raw; it was air dried. What's your thought around freeze dried raw options?
I mean, it's going to be better than feeding a kibble. So when we talk about levels of food to feed, kibble is going to be lowest. It's not the most species appropriate biologically available food. And then we have canned raw, and then we have this dehydrated raw that kind of fits in between canned and raw. Mm-hmm. So what's nice with that is you can use that instead of kibble, or you can use it as a topper, which a lot of companies advertise or market their product as. It's going to be more bioavailable because it's not as blasted with heat, creating, inflammatory products in that kibble. Mm-hmm. It's also not destroying all the nutrients that are available. So it is going to be a little bit better. It's not as good as like a home cooked diet or a raw, which you have more control over, but it is going to be a step up from your kibble diets.
Got it. And most of them seem to incorporate organ meats in there as well, and or some bone meal, et cetera, which seem to make the balance a little bit more appropriate.
Yes. One of the things, though, that's interesting I did a recent webinar on cancer in pets and bone meal. We have to be a little bit careful with bone meal and knowing where the sources are coming from, because bone meal actually has a really high fluoride content, which increases the risk for bone cancers like osteosarcomas.
The irony.
Really scary. Yeah, exactly. So because it's stored in bones. And so when we're grinding that up, we're creating a concentrated source of fluoride. Fluoride's high in our water. It's high in bone meal. So if we're giving all of that to our pets, especially golden retrievers, German shepherds, those large breed dogs that are already at increased risk, right? So, and then we're adding in bone meal, we could potentially be creating a problem down the road for them. So kelp is another one that's commonly used for that calcium, that extra calcium. Doing a home cooked food, like we'll use the organic eggs and dry them and crush them up and use that in the food also a few times a week to increase that. And then also giving them bones to chew on also is another great source. So your chicken wings, your chicken thighs that are raw, right? Cooked. Yeah.
Yeah. So that's probably a good transition into the home cooked route, which is what you do for Finn. So why don't we just use your experience with Finn as a case study, and tell us how you feed that awesome boy.
Awesome. So home cooked is not for everyone. So there's my disclaimer. Home cooks can take time. It's part of our routine now. So he's about 75 pounds. So he is our child, literally. We spend as much on him as we would a child. But what I love about home cooked is that you can put your positive energy into that food. So that's a big part of helping to heal your pets. Also, our energy reflects on them. We're very interconnected, and I can control the ingredients. I know, well, as much as I can. Obviously, I'm not going out and taking the cow and doing all of that. But I have more control over knowing that those meats are organic, they're grass-fed, that they're sourced appropriately, and then I can use organic vegetables. And There are a couple sites that people can use to balance diets. So balanceit.com is one. There are some pros and cons to that, but it's better than nothing. You don't want to just put meat down, like cook some meat up, put some rice in, put like a piece of broccoli in, and that's not balanced. So we have to make sure that we have the right omega-3s, the essential fatty acids. We have to make sure there's enough calcium, because especially with dogs, they require more calcium than we do as humans. We also want to use a multivitamin so that we're adding in extra ingredients or nutrients and minerals that they truly need.
Mm-hmm.
And then we're also, what I do with Finn is I rotate different vegetables and fruits. So I use a lot of, for him, because he has cancer, I want a lot of antioxidants, anti-inflammatory foods in there. He gets a lot of broccoli. He also gets a lot of blueberries. So he's going to get what we call in the human world superfoods. So he also gets liver, so grass-fed beef liver, a couple times a week too, and he'll get those as treats rather than a normal dog treat. Sardines are another great source. And there are a few books out there that people can get too. So Dr. Ihor Bosco, he has a great book that you can use, and it's based around the Chinese medicine, the energy principles of using food to heal the body, whether it's for wellness or allergies, cancer patients, diabetics, heart disease. He covers all that in his book. So that's a great resource for pet parents to get. And then following those recipes and rotating what you're using is key, because you're going to make up for maybe this meal didn't have enough zinc in it, but then when you add in these other meats and vegetables, you're going to compensate for that, rather than just feeding the same thing over and over again, because we are battling soil depleted plants, and there's not enough bioavailable trace minerals and things like that. So selenium is usually low in plants. So if you're rotating what you're doing and knowing that, you can put those back into the diet, so that way your pet's not missing out on those nutrients they need.
Right. Excellent. And I love the point you made at the beginning of, you have the chance to, put energy into the food that your dog is eating. And, anyone who wants to learn more about that can listen to 2 episodes in particular, one with Kaitlyn Prasad on animal Reiki, and also Amanda Ree, who does a similar sort of practice with dogs and energy healing, etc. So if I'd like to take, I think you gave like a really good, overview and kind of philosophy around it. If you were going to make, so let's make it super tactical,
Okay.
Actionable. Sorry, the military in me comes out sometimes. So super actionable for a pet owner. What is Finn going to have for dinner tonight? And try to, as much as possible, give like a quantity of, I don't know, a fist size, or half the bowl is going to be this, a third of the bowl is going to be that kind of thing.
So this is an easy way to do this. So I think in ratios, right? So 1 to 1 to 1. So you want protein to your vegetables to your starches. So let's say Finn is going to get minced turkey. So let's do a cup of turkey, right? Cooked turkey. And then he's going to get a mixture of his vegetables. So let's do a cup of vegetables. So that's like a mixture of steamed. You always want to do like steamed, lightly steamed, because it's going to be a little bit harder to digest, especially if you're using cruciferous vegetables like broccoli. So steamed broccoli. Let's throw in some Brussels sprouts, and then some carrots, because those are easy. A lot of people are going to use carrots. And so that's going to make up the other 1 ratio, so another cup. And then we're going to do a cup of like organic brown rice, let's say. So that's going to be, add in some fiber, some starches, and we're going to mix that all up. For typically when you're doing a 1 to 1 to 1 ratio, you're going to do a 1.5 cups per 35 pounds of food per meal. And so the biggest thing too, this is where, a lot of our pets are overweight. And so it comes down to you being able to assess whether your pet's overweight or lean or just right. And so that's body condition scoring. If you start feeding your pet a home cooked diet and they're losing weight, bump up the food. If they're more active, like this is how I do it with Finn. It's not super scientific, but if he's more active and he's losing weight, I know I need to increase the amount. Usually I increase the protein. So I'll add in some sardines and add in extra things that will increase the fat amount and the protein, because I know he can tolerate that. And so that's where, when you start playing around with the different foods and what your pets, how they respond to it, you'll get a better idea. But putting your hands on your pet and running your hands along their side, if you can feel their ribs but you can't see them, they're good. If they're squishy, when you do that, they feel squishy, they're too fat. So you need to reduce the amount of food you're feeding. And if they're really bony and you can see their ribs, then you need to increase the amount of food. So that's a good guideline when you start doing this, because every pet's metabolic rate is going to be different. But that 1-to-1-to-1 ratio is a good guideline to follow. And that's something that Dr. E. Horbasco talks about also. And then, adding in a multivitamin. I like VetraScience is a good brand that a lot of people can get, and they have some good multivitamins, and the dosage is right on the back of the bottle. So you can look at that, and whatever your pet weighs, add that in. Make sure we're adding.
Is that a powder or a tablet?
It comes in a tablet.
Okay.
So, and then usually they just eat it. When you feed whole, like real food, usually your dog will eat what's in the bowl, usually. So most of the time, like 90% of the time. So knowing that, you can put, like Finn, if you saw his food bowl, he gets 3 different Chinese herbs. He gets an essential fatty acid. He gets curcumin. He gets a medicinal mushroom mixture. He gets like 3 other things, and they all go in his food, and he eats them every single time. So I think that's the biggest thing is, play around with some of those the foods that are good for us, right? So not fried chicken, real chicken that's like cooked normal, not in a bunch of like bacon grease. And then lightly steaming your vegetables, your organic vegetables, and then adding in like an organic brown rice or a starch, and seeing how your dog's digestive tract plays to it. I use probiotics. I love probiotics. That's the other thing I add in that I didn't mention. And so that's going to also help them with digesting the food. I use a lot of digestive enzymes also, especially if you're transitioning from a kibble to a home cooked diet. So those things will help them digest their food better.
Got it. So time check real quick. Are you good for another 10 minutes?
Yeah.
Okay. So the 1-to-1-to-1 ratio, to recap, that was basically the first being meat, the second being vegetable, and the third being starch. And roughly by volume, keeping that amount the same. And the thumb rule you used was 1.5 cups of each per 35 pounds. Do I have that right?
Total, your total, yeah.
Got it. Okay. So then it would be 1/2 cup for a 35-pound dog. It'd be 1/2 cup meat, 1/2 cup vegetable, 1/2 cup starch.
Correct.
Got it. And you mentioned brown rice as one potential starch. What other ones are in your toolkit?
So you can use like quinoa. Some animals will be okay using like sweet potatoes and things like that. You have to play around and see if they get diarrhea or, if they're not doing well with that.
Pumpkin?
You can add in pumpkin. Like the canned pumpkin's great. The unsweetened canned pumpkin. So that's really helpful. It has really good like prebiotics. It'll help them with the fiber too. So German Shepherds tend towards loose stools. Like they have really sensitive GI tracts as a species or as a breed. And so I know Finn, if I tweak things a little too much, like I know what I'm going to create. So I know he does well with, also organic barley can be another one that you can use. So the biggest thing is making sure that you cook it long enough, or use the sprouted versions too. So those are important.
Okay. Yeah. And so I was going to give the disclaimer there of all these need to be cooked just like as if you were going to eat them. So
yes.
Got it.
So if it's like hard and chewy, you need to cook it longer. It needs to be digestible for them.
Okay.
And that's a lot of times when you see it in their stool, like it just comes out whole because it wasn't digested, or maybe we need to add in digestive enzymes too to help them, especially if they've been on a kibble-based diet. Their pH is going to be off, their microflora, their microbiome in their gut is going to be off. So that's super important.
Got it. And you started mentioning some supplements, and I got excited there because many of these are in Sunny's Forever Golden products. So I'll just go down the list of what is in our product, and you tell me if there are any of these that you use or don't use, or if you have any comments on them. And of course, if you want to give any feedback on Formula Live here, I'll put myself on the spot. But a lot of research went into this, and we worked with a holistic vet. So we have organic alfalfa juice. Well, why don't I'll just show the screen and you can respond there. So we have organic alfalfa juice powder, BCM 95 curcumin, organic reishi mushroom, sensoril ashwagandha, maki berry, organic chlorella, L-taurine, green lip mussel powder, horsetail extract, and hawthorn leaf and flower. So
I love all that. Finn also gets powdered alfalfa, organic alfalfa too.
Okay.
When I remember, I'm not always, like I said, don't be too hard on yourself because I don't always remember.
The whole leaf powder or the juice powder?
It is the juice powder. Okay. So yeah. And then, the curcumin is really, really good for inflammation, and it's a good antioxidant. So curcumin's great, especially as I get older. There's so many uses for it. I also use it for the anti-cancer properties that it has for my own dog. Your reishi mushrooms, I love the reishi mushrooms. Those are fantastic. I do use, typically with my medicinal mushrooms, I use a blend because each one has different properties in it, which is great. Yep. So your reishi is really good though for exactly what you've posted in terms of the immune system. All the mushrooms with their beta glucans are really great. And then ashwagandha, that's a great, adaptogen. So that's going to help where it's needed. That's what I love about adaptogens, is that whether you have too much going on or not enough, those adaptogens are going to work in the body where they need to be. And so they're very safe. Obviously, if your pet, this is a disclaimer, if your pet is sick or on medications, you do need to make sure that there's no contraindications with any of these, because, we are using nutraceuticals that are affecting different pathways in the body. Yep. And drugs are doing something to pathways in the body, and we want to make sure that there's no side effects from using them. But yeah, the stuff that you have in this supplement is really good. So yeah, and I think help a lot of pets.
Yeah, well, thank you. I think the next one that was on the list there was maki berry, and I think before we were talking, you mentioned blueberries a bit. So the maki berry is kind of like a blueberry with benefits, is what I call it. But what about blueberries and other fruits for mixing into your dog's home cooked?
Yes. So blueberries I like because of the high antioxidant content. I don't use a lot of fruits, especially with a cancer patient, because I don't want those cancer cells to feed off the excess sugars. For dogs that have GI issues, apples can actually be really good, just like they can for us. But you want to be cognizant of the amount of sugar that you're putting into the diet. They do just fine. Most animals will take a treat, like a dried meat as a treat. So if you have a jerky that you make, or making sure that we didn't even go into treats, which is part of foods, like an organic jerky treat that's made in the US, and those are great treats. So feeding fruits, a lot of times we find if these pets are getting too much sugar, they're going to get overweight, they can develop diabetes, they're going to have insulin resistance. So we have to be really careful with that. Bananas, you can put a couple bananas in there, but I just find for the most part, you don't need to feed that much of a fruit to your pet.
Yeah, it seems like most of the micro, nutrition, phytochemicals, polyphenols, et cetera, can be found in the greens.
Yes.
Right. So.
Yeah, the biggest disclaimer, and one of the things I see a lot of, especially with pets on kibble, are urinary crystals or bladder stones. And so we have to be a little bit careful with the amount of greens that we add in. Like if they have an oxalate stone, those are high oxalate foods. So there's certain things like that we have to be careful with too, right, when we're looking at a home cooked diet.
Yeah, the cooking takes care of some of that, at least, especially if you strain it right with spinach and kale, pretty high in that, from my recollection.
Yes.
So should we go down the rabbit hole of I'm good for about another 12 minutes.
Okay, let's go there.
Okay, let's go down the rabbit hole of treats, and whether they do or whether they don't contain functional ingredients like Forever Golden does. What is treats? Go.
Treats. Okay, so treats is a food, so it's part of our pets are getting more and more treats. every day. And so a lot of people don't think it's adding up, but it truly is. Biggest problem I see with treats, well, there's a couple. So overfeeding treats, those are calories. And so that's contributing to the overweight population, like pet population problem that we have. So we need to be cognizant. If you're feeding a lot of treats, so let's say you have a puppy, right? You need to feed treats, you're training them. And so use treats that are going to be whole food based. So those jerky treats are great as long as they're not from China, because of the whole 2007 melamine incident where a lot of animals died of kidney failure from that. So that's why USA based is better. We do have bad products in the US though. That's the disclaimer. So that's where, looking for a human grade product would be ideal, but making sure that you're not overfeeding those treats throughout the day. So replacing the amount of food in the bowl for the main meal with the amount of treats that you're feeding. Keep in mind the calorie contents. So that's a big one. And then looking at the ingredient list on those treats, on that treat bag, just like what we did for the diets, the kibbles, like turning around that bag. What is in this? Is their biggest thing, making sure that there's no preservatives. That's a big one in treats. Is there that BHA, the ethoxyquin? Is there the other if you see preservative? I don't like seeing natural flavorings either. What is a natural flavor? I'm the natural pet doctor, but I don't know what a natural flavor is. So
well, I come from the human supplement industry, and I can tell you that it's pretty darn broad.
It's not good usually, right? So that's something also. Why do you need to add flavors to a meat, right? So if it's being processed appropriately, you shouldn't have to add anything else to it.
Yeah.
I like making my own treats.
Okay.
So you can do, a lot of people will do like a dehydrated sweet potato, right? Chopping that up and using that, even getting especially if you're training puppies, getting an organic cheese and just chopping it into tiny little bits can be helpful. The liver that I use, cooking it and feeding little tiny bits of that can be they love it. So that's another great source, and it's not messy. Some people don't like the smell of liver and cooking it, but sometimes you got to do what you got to do. Right. So I have a frozen pumpkin yogurt almond butter treat that I use. Super easy. It was amazing. It was so easy to make. So just mixing yogurt with canned pumpkin and a bit of almond butter and putting it in an ice cube tray and freezing it. That's what my dog gets every night. He has trained me to give him a treat at night, and that's what he gets. And I know it's good for him. So I don't have to worry about, what is there an ingredient in this treat? Like with him, I have to be careful of like rosemary, and that's in a lot of good treats as a preservative, a natural preservative, but it can lower the seizure threshold, which he's prone to because of his brain tumor. So that was really eye-opening when I had to look at all of those labels and go, I can't feed any of these to my dog anymore because I don't want to take that risk. So
a couple of treats you mentioned there, you had the cheese and yogurt. So thoughts on dairy?
So depends on the type of dairy, just like for people. You want a higher fat, organic. If you can get like grass-fed or even raw, that's ideal. Goat's milk would be best. Okay. So cow's milk is pretty inflammatory for both people and dogs. There are different types of cow milk, different types of cows, but we typically don't have the right one in this country. So if you can get goat's milk, you can find that at most pet stores or like your boutique pet stores, you're going to find that.
And what about goat milk kefir or kefir in general?
Yeah, that'd be great. So that's going to add in those extra probiotics and the good bacteria. Now, keep in mind, you probably don't want a ton of it because you might actually upset their stomach if they're not used to having all those good bacteria in there. It's just like people, right? You take too much kefir, you drink too much kombucha, sometimes it doesn't end well. So it's the same with pets.
Got it. And you mentioned that you also put probiotics in Finn's food. So what type or how do you administer that? Is it just a powder or capsule or what?
So his are capsules. There's quite a few different probiotics. There's There's a lot that goes into probiotics.
Yeah, we won't go down that rabbit hole.
Yeah. So I use one that's actually a prescription-based product. It's called Visbiome. The human version is actually used for patients that have ulcerative colitis and inflammatory bowel disease. And there's been a lot of research, and it's not the cheapest probiotic, but it helps him. So I feel like he has really good solid stools, and his gut health is really good, and his appetite's great. And I feel like it's reducing inflammation in his body. So I like that one. That's the one I've been using. ProViable is one on the market that tends to be more broad spectrum compared to something like Fortiflora. That's another one. The Fortiflora has a beef digest in it. So that makes me a little bit like, probably not my first choice.
What is beef digest?
It's a flavoring.
Hmm.
So if you have a dog, what was that?
Made of what?
That's a good question. So that's the thing. If you have a pet that has any food sensitivities, I stay away from that, and I would use something like ProViable.
Okay. Okay. So one of the things you talked about earlier on, actually probably before we started recording, was that intrigued me was, appropriate food and or care at like the 3 different kind of stages of life. Can you say a little bit more about that before we wrap up?
Yeah, definitely. So we have typically 3 different life stages. We have our puppies and our kittens, our adult dogs and cats, and our senior pets. And so typically our puppies and our kittens are really healthy, right? So we're feeding foods that are just well balanced, have lots of nutrients. Your growing animals are going to have a different calcium phosphorus ratio. So especially for large breed dogs or giant breed dogs, sometimes I will recommend a good kibble, well-balanced diet, because we don't want to mess up that ratio and affect their joints and their limbs. There are ways to do it. You just have to make sure that we're actually doing it the right way. So that's where working with someone that knows what they're doing in regards to those growing phases. Now, typically when we get to that 6-9 months of age, that's where if we're not feeding a real food diet, we want to get them onto either raw, home cooked, or even that dehydrated raw. Can's going to be better than kibble. So that's where you're using a diet that's for your adult pets. So adult pets going to be anywhere between 1 year of age to about 7 or so. Cats are a little bit later on in life, that we classify them as a senior. And then from that 7 years onwards, those are your senior pets. So senior pets, they're going to need more of your supplements, your nutraceuticals in their diets. So we're helping their aging joints. They're going to have more inflammation. They're more prone to chronic illness and cancer because they've been combating all the pesticides and environmental factors and things that are in the foods their entire life and stresses. And so if they have kidney or liver disease, that's where we can tailor their foods to adjust for that, where we're not putting as much burden on those organ systems. So each phase of the life is going to have something different. And every animal in that phase of life is going to be different too, because I've seen kittens develop cancer, and there's adult dogs that develop cancer or other things too. And that's where we need to adjust what we're feeding with higher proteins, or even going to that raw diet, or I won't even go down this rabbit hole, like the keto diet. So, so we adjust to based on those animals, but there's general guidelines that we can follow for each life stage, so that we're maximizing their wellness for that life phase with their foods. Because like I mentioned in the beginning, nutrition is the foundation for health. So if we're not putting the right things into the body, how are we expecting them to make the appropriate things biologically to support their health throughout their life? They're going to run out of energy. They're going to run out of nutrients. And then we go down that pathway of disease.
Yeah. Okay. Well, we should probably wrap up here. So my big takeaways here were, when it comes to food, were number one, be cautious with kibble. Be sure to read the label, look at the guaranteed analysis, find out the carbohydrate content, look at the actual ingredients on there. An air dried product, for example, like Ziwi was a brand we recommended, can be great to get some more organ meats in the diet, as well as, higher quality meats. And then, same with raw and freeze dried options out there. Again, it all comes down to looking at the label. And then, another holistic vet is also kind of in the same camp as you, is recommending the a home cooked meal that is appropriately balanced. And again, to make that actionable for people, it's about 1.5 cups of food per 35 pounds of body weight, with that 1.5 cups broken down into equal ratios of meat, vegetables, and a good healthy starch. So that'd be like 1/2 cup of each of those would lead to 1.5 cups. And then supplementation, we went down that rabbit hole a bit, but lots of great topics there, covering omega-3s and probiotics and anti-inflammatories, antioxidants, etc., multivitamins. So super helpful. Dr. Katie, any final advice or thoughts for our listeners before we close out?
So I appreciate being here again. So thank you for taking the time to increase people's awareness around these important topics. Biggest thing, remember, never beat yourself up if you can't do a home cooked diet, because you can feed a kibble that's going to be better than feeding, say, something like kibbles and bits. Or add in those vegetables. When you're eating vegetables, real people food is okay to feed to your pet as long as it's healthy. So don't feed them cheeseburgers, but if you're cooking up broccoli, give your pet some, put it in their food bowl. Start mixing those things in, because it's going to make a huge difference to their health lifelong.
Yeah. So even if you go the leftovers route, that's helpful to get some of that in there as maybe a first step that anyone can do, or people are probably doing anyway. So
yeah, just make sure there's no like gravy or things like, we don't need to create pancreatitis.
Right.
So
no chocolate.
Yeah, no chocolate, no onions, no grapes, no raisins.
Right.
Don't give them alcohol. Like, comment, like, just don't do that. So they don't need it.
All right, Dr. Katie, thanks so much. So Dr. Katie Woodley, you can learn all about her and follow her at thenaturalpetdoctor.com, on Facebook and Instagram at The Natural Pet Doctor. You can subscribe to be part of her Natural Pet Tribe, where she has all kinds of great info, including webinars and more. And of course, goes far beyond just the topic of food. So thanks, Dr. Katie, for sharing your wisdom, knowledge, and experience. And send our best to Finn. And thanks so much for being on the show.
Yeah, thank you.
Okay.